Good afternoon, everybody. The sun is over the yardarm, and I think we can begin. I'd like to welcome everybody. My name is Perry Newman. Thank you for joining us, and I'm the Executive Director of Konbit Sante. We're very pleased to welcome you to today's webinar on pediatric care in the north of Haiti, and specifically at the largest public hospital in the north, Justinian University Hospital. I'd like to welcome those who are new to our work and our organization, and also to welcome to those of you in the audience who've been with us through thick and thin, hurricane, earthquake, epidemic, and now the most recent round of political instability. Your support and your partnership with Konbit Sante mean everything to us, and I'm very grateful for it. I'm joined today by my colleagues, Tetsuta Noguchi, Konbit Sante's Country and Program Director, and Dr. Emanise Muscadin, Faculty Consulting Pediatrician for Konbit Sante at Justinian Hospital. A bit more about my colleagues in a moment. I'd like to begin, however, by sharing just a word or two about Konbit Sante, and then I'll turn things over to my colleagues. Konbit Sante, now in our 24th year, is an international nonprofit NGO with a small home office in Falmouth, Maine, and with all of our healthcare systems and management work done in and at the vicinity of Cap Haitian, which is Haiti's second largest city on the northern coast of the country, about 120 miles north of Port-au-Prince. As noted on our website, Konbit Sante works to develop a sustainable healthcare system in the north of Haiti with maximum local direction and support. We're partners side by side with 5 healthcare institutions in the north, 2 of which are public hospitals, Justinian University Hospital that I mentioned, and Fort Saint-Michel, and 3 of which are private, ULS, or Unité de Lutte pour Santé, Hôpital Serving Santé, which is in Limbé, about 15 miles from Cap Haitian, and HCBH, which is affiliated with the Baptist Convention of Haiti. Our partnership with each of these hospitals and clinics involves different levels and different types of support and input, ranging from providing courses and research methods to medical equipment, from funding for additional nurses to supporting community health workers and traditional birth attendants. The common element is that we do not impose a here's what's best for you approach upon any of our partners. We believe in and we live by the notion of a Konbit, a collective, collaborative, and mission-focused approach to getting things done with maximum local support and input. Our longest standing relationship is with the Justinian Hospital, and that's where we'll focus today's discussion, which features Dr. Muscadin. To introduce Dr. Muscadin, I'll shortly turn things over to Tetsuta, but by way of background, Tetsuta is a public health professional with more than 15 years of experience working in Zimbabwe, the United States, Haiti, and Ethiopia, focusing on the health of women and children, immigrant and refugee groups, and economically marginalized communities. She's interested in program development, monitoring and evaluation, research, and capacity strengthening. She grew up outside of Washington, D.C., and holds an MPH from the University of North Carolina, Chapel Hill. In better times, which is to say in times of greater security in Haiti, Tetsuta is on site at the Justinian Hospital every day and begins every day with a walk through the pediatric service. I'm very happy now to turn things over to my colleague, Tetsuta Noguchi.
Thank you, Perry. Hello, everyone, and thank you for joining us today. It's my pleasure to introduce you to Dr. Emanise Muscadin, our presenter today. Dr. Muscadin joined Konbit Sante in January as an attending faculty in the pediatric department at Justinian University Hospital. We first met Dr. Muscadin over 10 years ago when she was a pediatric resident at Justinian. Even then, her leadership skills, clinical acumen, and passion for education were evident. Following her residency, she worked for 6 years at one of the premier hospitals in northern Haiti, where she bolstered her clinical skills by participating in research projects that examined the effects of innovative treatments on pediatric patients with diabetes and sickle cell anemia. She returns to Justinian University Hospital with a wealth of clinical research and leadership experience to coordinate medical care at hospitals serving some of the poorest communities in northern Haiti and to mentor future generations of Haitian pediatricians. It's my honor to introduce Dr. Muscadin, who will now discuss the challenges, the needs, and opportunities to improve health outcomes for pediatric patients in northern Haiti. Dr. Muscadin?
Thank you, Tetsuta, for the introduction. Good afternoon to all of you. Thank you all, dear collaborators and other members of this great committee for joining us this afternoon. And thank you for your solidarity with the children of Haiti. I joined Konbit Sante 1 month ago, but I have always felt close to Konbit Sante because Konbit Sante accompanied me and my fellow pediatric residents during our specialized training at Justinian University Hospital from 2011 to 2014. Also, Konbit Sante helped us save many lives by providing the pediatric department with equipment and supplies, allowing me as a resident to take care of sick children. Konbit Sante also helped me because Dr. Sinclair was a pediatrician who was working to Konbit Sante for many years, and he was my mentor during my 3 years of residency. All this is to let you know that I already felt an official part of Konbit Sante, and I dream of being an official member. And for the past 1 month, this dream has come true. Konbit Sante also will allow me to live out my goals as a pediatrician. Indeed, helping the most vulnerable people has been my dream. You know that Justinian University Hospital receives the poorest population, and without Konbit Sante support and the pediatric service, I don't know how many deaths we can have per week or per month, or I don't know how great our frustration will be as a pediatrician. Konbit Sante, by offering me this role as a trainer and care coordinator, will allow me to give back a little of everything I have received. Today, in that presentation, I will discuss about the current situation in Haiti, give also an overview of the pediatric service at Justinian University Hospital, and speak about our challenges, the progress we have made, and our vision for the immediate future. Like you know, and also I understand that Haiti has been in the news internationally, and I'm sure many of you are interested to know what is happening on the ground. The situation in Haiti, like you know, in Port-au-Prince, is very bad. There is widespread violence. The population is at risk of famine, and also all health facilities have shut down. But in contrast, the situation is not as alarming. But we are seeing a rise in insecurity, in food insecurity, and health service are compromised by a lack of public power, fuel, and inflation. Also, for now, there are many people, we are moving from Port-au-Prince to Capation. Next slide, please. Now, I'm going to give you an overview about the hospital. Justinian University Hospital is located in the northern department of Haiti, particularly in Capation. It is the second largest public hospital center in Haiti, with a capacity of 300 beds and 10 basic services and multiple specialized needs, including pediatric service. Justinian is the one of the 16 public hospital with residency program for doctor residency, for nurses, and also for technicians of laboratory. And with all these, I can say Justinia is a departmental reference hospital. Next slide, please. An overview about the pediatric service. Pediatric service has two principal departments, one for outpatient clinic and one for hospitalization. The hospitalization has a capacity of 50 beds divided in 4 rooms, including an emergency room, a neonatal room, a pathology to kids from 2 months to 16 years, and a room for malnourished patients. Also, it has 2 isolation rooms for contagious disease. I can tell you also that each year, University Justinia Hospital in the pediatric service receive around 4,500 children in outpatient clinic and 1,005 outpatient in hospitalization. With Konbit Sante support, next slide please, Elonga's partnership of pediatric service focus on data-based quality improvement initiative, including introduction at CPAP for baby with respiratory distress or for prematurity baby, access to essential medicines for the kids, upgrade facility, volunteer supporter training, and reviews mortality, morning reports every day, and others. Next slide, please. In 2017, with Konbit Sante support, we inaugurated a new pediatric ward with a better big size. The size of our facility more than double, and which is the number of patients seeking care. But at the same time, we saw a reduction in the staff, the doctors, pediatrician from 5, the nurses from 21 to 14, and the resident from 12 to 8. In 2021, in the next slide, please, a study done by the 3rd resident in the pediatric service showed a strong association between the shortage of nurses and mortality among premature neonates from 22 to 26 weeks gestational age from 2018 to 2019. The study also revealed an association between premature mortality and lack of electricity, oxygen, and functional incubators. Next slide, please. In that study, with Konbit Sante support, we have made improvements in the availability of oxygen and electricity. In the next slide, please, you can see in the service, we have some bottle of oxygen. In the next slide, some panel solar for the electricity. But there is more work that needs to be done. Now, in first word, I'm going to tell you about our vision. Our vision principle is decrease preventable death and offer a better quality healthcare to the children of Justinia University Hospital. And we hope to achieve that goal by improving patient monitoring. To improve patient monitoring and care, we need to increase the number of nurses. Because even you know already, the majority of patients admitted to the pediatric service are unstable and therefore require sustaining monitoring. In neonate, we have to have more nurses, one nurse for 10 newborns, and we have 50 beds, and the beds are almost always full, and sometimes in the night, we have only one or zero nurse for the unit, and I think increase the nurses will help to improve patient monitoring and care. And like you know, the hospital administration does not have financial research to interview to a lack of adequate support from the central government. Also, we need to increase the number of cleaners to do a better cleaning in the pediatric service, to clean the material, the incubators, to clean the room, and also like that, we can help to decrease nosocomial infection. And need also to ensure availability of functioning equipment, incubators, and other materials by conducting inventory and assessment. Under Konbit, the overall situation in the country is worsening. We are seeing increase in insecurity, loss of jobs, closure or inadequate functioning of peripheral health centers. We also see a decrease in vaccination coverage and a rise in the number of several malnourished children and the number of children who arrive at the hospital in bad condition or in serious condition. Even with these challenges, we remain hopeful and dedicated to providing the best care for the children of our community. I hope Konbit Sante remain in a Konbit with the hospital and with the help of all of you, supporters and friends. Justinian Pediatric will be the light that keeps hope alive for the new Haiti with the healthy children. I thank you so much for all you have done, and thank you for your commitment to Haiti's children. I'm ready for comments and questions.
Those of us in the here on the Zoom would be most interested in or what are your daily takeaways?
Daily takeaways are that they absolutely need more nurses. What she expressed is what I notice and what I observe every day. It's just the lack of adequate nursing and nurses in the service throughout the day and especially at night. What I have noticed over the past, let's say, 6 months is an increase in the number of malnourished kids who are being treated in the service as opposed to outpatient care, and a decrease in the number of parents who feel comfortable in coming to the hospital for outpatient care. So we're still seeing kids, parents seeking care for serious health issues, but vaccinations, runny nose, just kind of regular outpatient care. Parents maybe don't feel comfortable enough to venture out to seek that kind of preventative care.
We do have a question in the chat,
Yeah.
which follows on nicely from that, and we have made an effort to increase staffing. Can you talk a little bit about how that works?
Yeah. So what are the impediments to increasing staffing? I think Dr. Muscadin touched on this very briefly. The impediment is inadequate funding from the central government. And yeah, Justinian, as you all know, or as at least you learned today, is a public hospital. It's poorly funded public hospital, and the central government, the Ministry of Health, doesn't have the funds to increase the number of staff across the board, and particularly in the pediatric service. How might we increase staffing? I'm hoping that, and that Konbit Sante, through this Konbit, we can raise the funds to hire the nurses in the pediatric service until the time is right for the central government and the Ministry of Health to take over the funding of those positions. And I'm really glad that Dr. Muscadin is back to join us, because I think she's the right person to answer the next question. How are patients, Dr. Muscadin, how are patients in the malnutrition unit cared for?
Yes, for now, in the unit service, it's not for now. Since January, in the service, we have the beds in malnourished room. The beds are full since January. We have many kids with severe kwashiorkor, many kids with severe marasma, and every day we have to try, first of all, to put them with a good health, like treatment for comorbidity first, and after that we have to do treatment for the malnutrition. But I can say since January, malnourished room is full every day, and I think we put also some kids malnourished in Pato, because malnourished room is full, and we don't have more capacity for malnourished kids, and we put them in Pato and to do the treatment. But there are some with severe problem with severe infection, with severe problem of pneumonia and meningitis, some with meningitis. So we have to treat the infection, and also we treat the patient. But with treatment, they're going better.
Thank you. John, Devlin, I see you've got your hand up.
Yeah, thanks, Tesla. Thank you, Dr. Muscadin. Delightful to meet you, and thank you for your talk. What's the role of the hospital in vaccination? I'm just unfamiliar with the program in Haiti. Is there a governmental effort to vaccinate all children, or how active is your unit in getting kids vaccinated and making sure they get what they need? And so that's my first question. My second is, what's the water situation in CAP? Do most people have clean, potable water, or is that not widely available?
Yes, there is a public program to vaccinate the kids. It is from MSPP, and they cover many infection diseases. The problem sometimes with the coverage is sometimes when there is trouble in the country, the parents can come in the hospital to give the vaccines, or sometimes some parents say, I have no money to pay to come to the baby to take the vaccines. And also, now many insecurity, and they have to leave home and come in. Sometimes the street is bad, and all that this reason decrease the coverage vaccination and increase the infection with the kids.
La deuxième partie de question, c'est la situation avec la disponibilité de l'eau. Quelle est la situation avec l'eau frais?
The problem is in about the population who is living, for example, in rural section. Sometimes, unfortunately, in many parts of Haiti, there is no good water to take, and sometimes is je peux parler et puis tu traduis pour moi. Oui, parfois pour la population en dehors des villes, donc il n'y a pas vraiment d'eau potable. Parfois c'est au niveau des tuyaux, on met des puits, ok, et on boit l'eau des puits et c'est pas filtré. Okay? Et puis comme ça, il y a plus de risque d'avoir des typhoïdes, d'avoir parasitose et d'avoir d'autres pathologies comme ça.
Okay, so there are many parts of Haiti in which water is not available. Safe drinking water is not available, and people are trying to cope with this as best they can through a variety of methods of filtration and access to other sources of water. Is there a problem with water in the hospital?
Et normalement, oui. Malheureusement, je peux dire oui, il y a problème d'eau dans l'hôpital, au niveau de l'hôpital. Et c'est dur de dire que parfois, et même les résidents qui font des services comme s'ils n'ont pas vraiment accès, qu'ils doivent acheter, etc. Mais au service de pédiatrie, des services pédiatriques, with Konbit Sante, sous le support de Konbit Sante, donc on a fait quelques arrangements pour que dans le service de pédiatrie, on trouve de l'eau pour que les gens se lavent les mains, etc. Mais oui, à l'hôpital, dans les autres services, et tout comme à la résidence comme telle où les résidents habitent, il y a beaucoup de fois problème.
Okay, so generally speaking, in the hospital and in the pediatric service, there's a problem with water. The residents experience this problem, but Konbit Sante has made an arrangement with the hospital to provide water as best we can to provide that support, although it remains an ongoing problem on a daily basis. Okay, that's my fractured translation of the French. And there are some other questions in here, so I'll turn it back to Tetsuto. Apologies for my translation, but this is good. No.
Okay, so Polly Larned asks whether the pediatric residents are coming to work.
Les questions, les résidents, sont-ils à l'hôpital chaque jour? C'est difficile s'ils n'est pas reçoivent le paiement, le salaire. Sont-ils à l'hôpital chaque jour?
Oui. Et bon, les résidents sont venus chaque jour. Et comme je vous avais déjà dit, parfois, on n'a même pas, quand on n'a pas d'infirmière, c'est les résidents qui font tout pour les enfants. Ils reçoivent les enfants, font des signes vitaux, donnent des médicaments aux enfants. Les résidents sont là du lundi et au vendredi, OK, chaque matin. Et à partir de 2 heures, le service de garde, 2 heures PM jusqu'à 8 heures du matin. Et pour les week-ends aussi, samedi, le service de garde fonctionne toute la journée, toute la nuit. Et le dimanche aussi. Je peux dire que oui, au service de pédiatrie, les résidents sont toujours là, soit en roulement avec garde ou bien tous les résidents pour voir les cas chaque jour et comment tourner comme d'habitude.
Okay, so as I understand it, I'm sorry, Doctor, I'll just try to translate that. So the residents are there just about every day, every Friday morning and over the weekend as well. They're quite dedicated. And despite the challenges of payment, they are quite reliable and are at the hospital regularly. I want to, if I can, draw attention, exercising a little bit of discretion here. There was a response from someone in our audience about the vaccination program, indicating that that we were talking, you were talking about the national vaccination program for children, but this is not by no means a sure thing. The UNICEF depot in Port-au-Prince was looted, and the central depot of the World Health Organization is currently closed. So it's a very, very dicey situation because the port of Port-au-Prince is effectively not functioning. And so the question is, how these vaccinations get in. Can they come in through CAP or other means? And I know that for participating in the Haiti Health Network discussion yesterday in a different group, we learned that there are a number of organizations trying to bring things in by air on an emergency basis. So hopefully that will clear up as well. I will relinquish the microphone. With other questions, please.
Une autre chose pour les résidents, et c'est que pour le moment, et ça fait plus ou moins un mois, on reçoit beaucoup d'enfants qui viennent de Port-au-Prince. Okay? Ils sont venus avec les parents. C'est comme si parfois la salle est remplie et à la tente, donc on reçoit les enfants et puis ce sont les résidents aussi qui les voient même quand on les paie pas, parfois ils se plaignent. Mais quand même, je peux dire qu'ils donnent un bon service aux enfants, surtout en ce moment, que les enfants vraiment, vraiment en ont besoin avec des parents qui laissent leur maison, qui sont stressés et qui n'ont pas de moyens, ok? Donc, les résidents aussi, donc, ils ont une grande humilité parce que parfois, il y a des parents qui viennent qui disent, ah, je vais pas rester avec l'enfant parce que je n'ai pas de moyens pour payer les médicaments. Mais avec l'aide de Konbit Sante, donc Konbit Sante nous a fourni des médicaments essentiels pour les enfants et les résidents disent non, 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 vous pouvez rester et puis on va donner des médicaments et à l'enfant, donc, et comme ça, l'enfant pourra être traité et être.
Okay, so the residents are displaying a great deal of humanity and humility, helping the parents who come, and regardless of the parents' ability to pay for medication, the residents are helping as best they can and displaying a great deal of solicitude towards the patients, which is very, gratifying as the head of the pediatric service. So other questions?
One question or another question is from Dr. Vic Herson. He wants to know, Dr. Muscadin, can you hear me? Or maybe, Harry, you might have to interpret this. The question is whether the service has reliable electrical power.
Est-ce qu'il y a des services pour l'électricité dans le service pédiatrique? Avez-vous de l'électricité chaque jour ou non?
Et avant, oui, il y avait problème d'électricité, comme je viens de dire, mais ça fait quelques temps qu'avec support de Konbit Sante, on a installé des panneaux solaires avec inverteurs. Donc, pour le moment, ça fonctionne seulement et dans la salle de malnutrition, parfois, il y avait coupure, mais Konbit Sante et avec le staff et l'administration sont en train de voir comment résoudre ce problème. Mais oui, je peux dire qu'il y a pour le moment pour l'électricité, donc ça peut aller. Ce qui arrive que parfois quand il n'y a pas de soleil et quand il y a comme les saisons sont pluvieuses et il y a beaucoup de pluie, il n'y a pas de soleil, il y a certaines coupures. Mais à ce moment-là, on priorise les néonatologie et les autres enfants. Mais oui, avec l'aide de Konbit Sante, donc les panneaux, donc jusqu'à présent, ça marche.
Okay. So the only place in which there is reliable electricity is in the malnutrition unit, as I understand. But owing to the solar installation that was put in by Konbit Sante, there's adequate electricity on days when it is sunny. When the weather is poor, however, service is interrupted, and this, of course, is something that you find, obviously in many situations in which there's a solar installation of a relatively small size. So the infrastructure remains a problem, and of course, we're continuing to monitor the status of our own the integrity of our own solar installation at Justinian Hospital as well. So. All right. Well, I do hope that people will well, feel free, as I'm wrapping up here, it is not too late to keep those cards and letters coming, to send a note in the chat if you have another question. But I would simply say to thank you very much for your attendance today and for taking the time to learn more about the challenges of building and strengthening pediatric care in Haiti. You can learn more about our work at our website, konbitsante.org. And I'd be remiss in perhaps committing executive director malpractice if I didn't mention that we are focusing our fundraising efforts on the pediatric service this month. We're hoping to raise $60,000, as I said, to support the pediatric service for a year. And we're about halfway to that goal. So more work to be done. And so I hope you'll consider supporting this important work for the children and families of Northern Haiti. I want to thank everybody that's joined us. I want to thank Dr. Muscadin in particular. I want to thank everybody for their patience with my French. And I hope that if you have further questions, you'll not hesitate to reach out to anybody at Konbit Sante for further information or ways you can get involved. If you look in the chat, you can see there's a link to our website. And I want to thank you all for supporting the good work that we do, and in particular, supporting our staff in Haiti who are working under very challenging conditions. So thank you so much for your time today, and I wish you all a pleasant afternoon.